All right, good morning, everyone, and thank you for joining us today. My name is Jeannie Long, and I'm the director of the School Health and Nutrition team here in Washington, D.C. A couple of housekeeping items before we get started. Today's presentations will be recorded, so I kindly request everyone to keep themselves on mute. We welcome discussion in the chat box. During the presentations, I will monitor the chat and keep track of questions. So very likely the presenter won't be able to answer your questions as she is presenting. So I'll keep a running list as we go. And you can see that chat icon if you hover your mouse over the bottom of the screen. We will have both speakers present, and then we'll dedicate the last 15 to 20 minutes or so for questions. So this webinar is part of a short series that Save the Children is bringing to you to focus on best practices and lessons learned around menstrual health and menstrual hygiene management. I want to thank Child Sponsorship Innovation Fund for supporting our team to be able to bring you these international MHM experiences. Today's presentations will focus on the integration of gender transformative strategies with menstrual health programming. These two presentations that you'll hear today are near and dear to our hearts as they come from our own school health and nutrition programming in Mexico and Kyrgyzstan. These two country examples are an interesting comparison, as both projects have adapted choices as a critical component of their gender transformative programming, yet their program designs and many of their activities are quite different. UNIPARK will speak more about the innovative ways they monitored their program and some of their research efforts they took to better understand the results of their work. And Sofia Garza will talk about what was measured to evaluate the project and the results of those evaluations. Both projects highlight how critical meal is for ensuring programs are gender sensitive or gender transformative. Since both projects involve choices, I wanted to give a little bit of an overview. It's a curriculum that was developed by Save the Children that targets girls and boys ages 10 to 14 in the formative years of adolescence. Choices engages very young adolescents in developmentally appropriate activities that stimulate discussion and reflection in order to nurture alternative views of conventional gender roles and behaviors. It was originally developed in Nepal in 2010, and in 2013, through a mixed methods evaluation, it was revealed that children who participated in choices had improved gender attitudes and practices relating to discrimination, social image, control, and dominance. Also violence, attitudes to girls' education, and acceptance of traditional gender norms. Since then, Choices has been adapted for Save the Children programs in Bolivia, Bangladesh, Egypt, Ethiopia, El Salvador, Malawi, and Zambia. And for that reason, it was a curriculum that was chosen to be adapted for Mexico and Kyrgyzstan. Now, I'd like to introduce you to our distinguished speakers. Salome, if you could show the slides. Right now I'm only seeing something strange. Thank you. UNIPARK is currently based in Seoul, and she's been with Save the Children Korea since June 2014. She has been in charge and overseeing the Girls' Wellbeing, Menstrual Health, and Gender Equality program in Kyrgyzstan since it began in 2016. UNA provides technical assistance for sponsorship in 9 country offices, including Myanmar, Nepal, Bangladesh, Indonesia, Uganda, Ethiopia, Mali, Niger, and Zambia. She has a dual bachelor's degree in international relations and political science from Korea University, and a master's degree in political science with a focus on international relations from University of Chicago. Sofia Garza is our second speaker, and she is the Gender and Puberty Education Project Lead at Save the Children Mexico. She has been with Save the Children Mexico since 2017, beginning by coordinating a global platform for disaster risk reduction and supporting the installation and opening of a toy library in Acapulco as a community strategy for the reduction of violence. Currently, she supports the We See Equal Mexico project, a program funded by Procter & Gamble, whose objective is to improve gender norms and increase knowledge about puberty among school-age children. Sophia has a bachelor's degree in international relations. So now let's get started with Una Park, who is going to talk to us about the Girls Wellbeing Project in Kyrgyzstan. Una, off to you.
Thank you. Hi, I'm Una Park. I'm from Save the Children Korea. And today I'll be presenting to you about the Menstrual Health and Gender Equality Programming in Kyrgyzstan that Save the Children Korea supported. I've been part of this project from its beginning since 2016. And we're very happy to present to you on this project because it's a very rare standalone MHM project. Usually MHM has usually been part of a component of a part of a bigger education and SHM project. But this pilot programming was to really focus on the MHM education provided to girls and boys and to make it a more gender transformative program. Moving on to the next slide. The order of my presentation would be to just give you a brief background on Kyrgyzstan and then skim through what our program design looks like. As Janine mentioned before, both Kyrgyzstan and Mexico had programming for choices and MHM, but since our Sophia will be presenting more on choices and MHM CAP survey, I'll be more focusing on different other new approaches that we have taken in this project, which is on boys' puberty research and on girls' calendar diaries. And lastly, I'll talk to you about the working group that we formed in this project. Yes, so firstly on Kyrgyzstan, if you see on the map, it's among the many Stan countries. It's in Central Asia. Its capital is Bishkek, and it gained its independence from Soviet Union in 1991. Its population is about 6.3 million people, and of this people, 25% are 10 to 24-year-old. It's a very multi-ethnic and linguistic country. Mostly it's Kyrg, but there's about 14.7% Uzbek language and also 5.5% Russian language speakers. And their religion is 90% Muslim, and then you can see the other basic information below. Moving on to the next slide. There was a study in 2013 by UNFPA called the Gender Norms Perception Study in Kyrgyzstan, which showed that 1 in 10 had their first sexual experience between 12 to 14 years old, which gave us an idea that it's very important to give them puberty and sexual reproductive education, MHM education, very earlier on. Currently, Kyrgyzstan teaches their puberty education in their biology class, beginning from grades 6 to 11. And if you see the map, and if you can click for me one more time, our project intervened in 2 provinces, one in Chui, which is close to Bishkek, the capital, and another one is a rural province in Osh. Next slide. I'll tell you a little bit more on our program design. This picture is of a Kyrgyzstan girl explaining to her peers about how to use a sanitary pad. Okay. Our program design basically follows the SHN FRESH framework that I'm sure you're all familiar with. Our strategy objective 1 is to improve the equitable school health policies in Kyrgyzstan. And this is where we formed a working group of SHN and MHN practitioners, as well as local government officials, so we could provide a united voice on this front. And our strategic objective 2 is about establishing safe learning and hygienic environment for students at school. And this is mostly concerned with making a clean and safe wash facility, such as hand washing stands and gender segregated toilets and so forth. And our SO3 is focused on improving skills education and puberty MHM education at schools and communities. And this is where our activities such as choices and providing PMHM education is included here, as well as the boys' puberty research. And lastly, our SO4 is to improve school-based services at schools. And this include activities such as making sure that emergency sanitary pads and materials are available at school and forming a referral mechanism to a nearby clinic for any emergencies. Among this program design, I'll focus on, in this presentation, to tell you about the boys' puberty research. This picture is of a female teacher explaining in front of the boys about menstruation, MHM in general, and how to use a sanitary pad. You could see many curious eyes and attentive boys, as well as many shy faces. So next slide. Why did we focus on boys? And why did we want to do a qualitative research on boys' puberty education? First, if you can click once more, a teacher in Chui said, we always work only with girls and boys are always left behind. So we should care about boys and support them. And another is, we know that boys and girls have different unique needs during their puberty period. So instead of just focusing on MHM and girls, we want to make sure that there's no unintentional harm or reverse discrimination given to the boys while we're doing the MHM and Gender Transformative Programming. So we decided to learn more about what boys need. So if you can click once more. So through this project, we really wanted to make sure that boys gain the guidance and the education. And one more. And make sure they have sufficient puberty education materials available for them. Last but not least is so they develop empathy towards each other. So it's not just about boys having empathy towards girls during their menstruating period, but also girls learning that boys go through a different cycle of puberty changes of their own, and that they both need to empathize and understand those changes and respect each other. Okay, moving on. So what this research aimed to do is, first, we talked to the boys and we tried to understand their attitudes and beliefs related to puberty. And we really wanted to ask them how they think the puberty education should be taught to them. And second, we focus on teachers and ask about their comfort level in teaching these puberty education lessons to the students. And then we also talk with parents and girls to understand their knowledge and attitudes related to boys' puberty education. If you can click once more, what we wanted to do is make sure that this research tell us, one more time, where and how and at what age should boys learn about puberty. Next, what are the myths and questions boys have on puberty? And third, what kinds of puberty education materials would work best for boys? The methodology we took to go through with this project is, first, we convened 126 participants from 4 schools in Chui and 4 schools in Osh, 8 schools in total. And we formed them into different groups: boys, fathers, mothers, teacher, and girls. And mostly did a focus group discussion and also a key informant interview. For most of the teacher, fathers, and mothers and girls, we developed a questionnaire with the help of Emory University and generally asked them questions related to puberty, also questions related to boys' puberty, and for teachers about teaching life, school life, and teaching practices. But here in this presentation, I want to emphasize on the boys' FGD. If you can see in the picture, you can see that they're playing games. We try to involve them in a different way by making a game so that we could increase their participation, and they could also feel like this is a very fun activity where they can be more open about this somewhat sensitive puberty issue. So if you move on to the next slide, I'll tell you a little bit about what this board game looks like. You could see from the very end, there's a start line, and we will roll a dice. And if they come into different sections until the finish line, there are some activities that the boys have to be engaged with. First, the letter little symbol, if you can click for me once more, Salome. Yeah, this is an envelope where a boy's question is included. So whoever gets landed in this symbol, the students would read a letter from an anonymous boy asking a puberty question. And the person who landed in this spot would write down their answer. Their answer would be kept anonymous, and it'll be collected at the end of the game for us to see whether they're understanding the puberty questions correctly or not. Second, you could see the two boys shaking hands. That symbol is throwing questions about social changes during puberty. And so whoever lands in this spot would ask a question related to social changes that may occur in the puberty time. And third, you could see a thumbs up and thumbs down sign. This is where we do pile sorting statements. This meaning there's a pile with different statements about puberty facts and common perceptions. Here, they would pick any card from that pile, and they will read it to everyone. And if they agree with this statement, everyone would show a thumbs up. If they disagree, they would show a thumbs down. And this way, we'll see how well they're understanding their puberty period. And lastly, there is a symbol of mask, one with a smiling and one with a frowning face. This is about questions concerning emotional changes that happen during puberty. And so whoever is landed in this spot would ask questions that they had about emotional changes. Okay.
Yuna, this is just a
Yes.
10-minute, you have a 9 minutes, so I wanted to give you a heads up.
9 minutes left?
Yeah.
Okay. Yeah, thank you. Okay, I should speed up. So these are some of the statements that are part of the pile sorting pile. I won't go through them. You can read through them, but one is about resources, whether you think they're easy to understand. Another is about whether students think everything should be learned in puberty. But I'll explain more about in the results slide, in the next slide. So, yes, thank you. So what we found out from the thumbs up and thumbs down activity is that most boys do agree that they should learn about puberty in school, and they believe that the resources available to them are easy to understand. But it's interesting to note here that they think 50% agree that they learn everything they need to know about puberty in school, but the rest of the 50% either disagree or don't know, which means either the school are not telling them everything that they're curious about in school, or it could also mean that they also want to learn more about puberty outside of school. And if you click once more, there's a red box here. It shows that most 88% boys disagreed that they could ask teachers or even social pedagogues about their puberty questions. So here we could see that they don't have a good adult counterpart who they could rely on and ask about puberty questions. Okay. From the activities, we learned that they still believed in many myths. I won't go through them, but there were some interesting myths that they still believed is to be true. For instance, if you think about girls, you'll get acne, or if you are not getting taller, it is because you're not spending time with older boys. This was an interesting one where they thought that by spending more time with older boys, that they would think the physical changes that are happening to the older boys would somehow transfer to them as well. So we realized from these activities that there are still many misconceptions that a lot of the boys believed in. And you could click the whole part, and we could see that they're still asking many basic physical changes that happen in puberty. Yeah. The findings we found is one, concerning puberty materials, that there's lack of educational tools designed for boys. There were a lot of there were comparatively more MHM related educational tools available for girls, but not for boys. And those from the existing ones, they were mostly in also Russian language. So the 77% for Kyrgyzstan could not understand this existing tools. And third, the existing tools were very superficial in their description with minimal details. And they also mostly mention about the physical changes during puberty, but not the emotional, mental, social, or behavior changes. And for teachers, we found that there are lack of male teachers in general, and meaning there were lack of male counterparts for boys to freely discuss this matter with them. And also, teachers felt shy, especially the female teachers, when they have to teach puberty to boys. So what naturally happened is that they would skim over the puberty lessons and make students just study on their own. And for girls, what girls said for boys' puberty education is that boys tend to be more shy and not serious when during the puberty lessons. So we could see there's a lot of gap for boys' puberty education. And findings for home is for mothers. Interesting, they believe that mothers should speak with daughters, and they think it's the father's responsibility to talk to sons about puberty. And also that there was a persistent embarrassment and stigma surrounding this issue. And for fathers, they felt less urgency to talk to the sons about puberty and was in general very uncomfortable talking to their sons about puberty. So both at school and home, you could see that the boys have less resources and less people to talk about when they have puberty myths, misconceptions, or questions. Voices from the boys, what they said is something very similar, that they understand the physical changes somewhat, but not the social emotional aspect of it. And that they either talk to older boys to learn about puberty changes or just learn from their surroundings. And what they thought about the parents' relationship is that they have a harder time opening up to them because they want to be seen as adults and not to be treated as children. And they felt shame in talking about this topic to their parents. So there's many barriers for boys. The recommendations from these findings is one, both boys and girls felt that they should be getting the puberty education starting at age 12 to 13, and they want gender segregated puberty lessons. And they prefer to have lessons by young male teachers or even by a third party or a specialist like a medical specialist. So they feel more comfortable opening up to them instead of someone they see every day at school. And also they mentioned they would like this puberty class to be engaging by using cartoons and videos. Teachers, they said they would like to see puberty lessons occurring more in schools, and that they also prefer that an outside specialist teach this class. And also they would like to have more lessons to be interactive using more colorful visual materials. And one thing for teachers is they requested teacher mentoring so that the way that they could deliver these puberty lessons can be taught to them. And for parents, they also felt the need to be trained and to have more materials to speak with their children. Can you click once more? Yeah.
Yuna, you have
yes.
2 minutes left, but I'd like to give you a couple more minutes because I think the calendars are really interesting. So you may need to talk a little faster.
All right. Yeah. So I think the rest speaks for itself. So we could move on to the next slide. And we're using all this research we gave it to the Ministry of Health so they could provide more comprehensive education materials for boys. I'll go on to talk about Girls' Calendar Diary. Next slide, please. We did a Girls' Calendar Diary, and we'd like to recognize Penny Phillips Howard from Liverpool School of Tropical Medicine, who gave us this idea. The reason why we did this calendar activity is we wanted to investigate the relationship between menstruation and absenteeism at school. And we specifically looked at 7th graders. 27 girls volunteered to participate in this activity, and they did the diary for 3 months. If you, this is a template of the calendar diary. So it has the whole full month. If we can move on to the next slide, I'll show you more in detail. Here, if you could click once more, there's room for date of entry, and then there's room for a period date. So in the period date, you would write what day it is among your period, first day, second day, or third period. And we ask 4 questions. So first question asks, did you miss school today? And you could either say, yes, I missed the full day, or yes, some classes, or no. Second question is, what is your mood today? And that could be good, okay, or bad. And also rate your participation in school today, good, okay, and bad. And lastly, did you feel physically weak or strong today? Next slide. And the diary findings we found is that in the menstruation and absenteeism or even partial attendance showed really no association. This was a very interesting finding for us. We naturally assumed that a menstruating period, girls would more likely to be missing school classes. But in this particular activity that we did, it showed no significant statistical association. The same was true for the bad mood. The strong association was found for suboptimal participation. And by suboptimal, if you can click once more for me, it means girls who answered okay or bad. So on menstruating days, suboptimal participation was reported to be 1.7 times more likely than on non-menstruating days. And for feeling weak, it was similar. 2.6 times it was more likely that girls responded they were feeling weak than on non-menstruating days. And takeaway from this is that we noticed that menstruation does affect students' participation at school and their overall educational experience. So why did we choose the calendar diary? Is one, it was a good substitute when there is absence of or unreliable attendance rosters. And also, even if we do have attendance rosters, it's hard to go back to each student and say, ask them why they missed school. So instead, we gave them diaries for girls who were going through menstruation and tracked them for 3 months to see exactly if that was the reason for why they were missing schools. That's why we chose this approach. Limitations that I can think of this report is that it's a self-reported data. So girls, some girls reported they were very honest on it, but some girls felt they were looking at their friend's diary while they were doing it. So the authenticity has to be more tracked thoroughly when we're doing this. And also there was survey fatigue if it went on for too long. So it's something that we can't track for a very long period of time. Do I have time, Janine, or should I end here?
You have about a minute.
Okay.
Thank you.
Yes. So another thing we did that we felt was a best practice in this project is we formed a working group. You can go to the next slide. This working group consists of Ministry of Health, Ministry of Education, UNHCR, UNICEF, and other NGOs that are interested in SHN and MHM. What we did over the 3-year project period, we met twice per year, and so in total had 6 regular meetings. And we held a national conference at the end of this project where we shared our project results. And also all our project materials and results were shared in CD and distributed among the working group, as well as schools and local government. In this national conference, we talked about ensuring availability of hand washing soap, hand washing stand, toilet paper, and waste bins, and also making sure that we start puberty and MHM education earlier on. Right now it's starting from grade 6, but we hope to see it start in grade 5 before girls reach their menarche, so they have their information before the menstruation begins. So this was important for us because we wanted to ensure sustainability even after a project ends. And so we felt that it was a good best practice that we wanted to share. Sorry, I went over time, but I'll end here. Thank you.
Thank you so much, Yuna. That was excellent. Don't forget to put your questions in the chat box. And now I will turn it over to Sophia.
Thank you, Jeannie, and hello, everyone. Thanks for joining today's webinar. I know it's quite early or late for some of us, so I really appreciated you being here. On the next slide, you can see that this is a quick overview of the agenda. I'll start by discussing Mexico's approach and perspective on gender, and I'll give a very brief introduction to our program activities, and then we'll jump right into MHM, focusing on the results of 2 years of implementation. So on the next slide, what we can see is focusing on how gender and SHR are perceived in Mexico. The OECD concluded that we are headed in the right direction, but there is still a long way to go. When it comes specifically to education and gender, we have successfully closed the gap of school enrollment between boys and girls in elementary and secondary school. But at the same time, Mexico has the highest dropout rate in higher education. And this rate is deeply related to gender, since boys and men are expected to work and provide for their families, while girls and women leave school because they either get pregnant or get married or just have no family support to continue with their education. There is little evidence on menstrual health management, but there are other indicators that show the lack of quality education on sexual health and reproduction, such as the average age of sexual debut is 12 years old, and Mexico holds the highest rate of teen pregnancy in Latin America, which is alarming. As for gender-based violence, 6 out of 10 women over 15 years old have suffered some type of gender-based violence. We are currently experiencing the highest homicide rate in Mexico's recent history, and it is estimated that 9 feminicides are committed every day. So in general terms, gender issues are on the public agenda, which is a necessary first step, but these issues are not being correctly addressed. There's one specific example of this. Here in Mexico City, there are designated subway wagons for only women to use because of the high rates of sexual harassment. But in the end, it's just about protecting women rather than preventing gender-based violence and other harmful practices based on rigid gender norms. On the next slide, I'm taking from what Jeannie has already presented on choices, and this is an overview of how this program is implemented in Mexico. The program is named We See Equal. So each cohort of implementation lasts a semester in which we hold 3 teacher training sessions for teachers to implement choices in their classrooms, and we are given in-class observations in which we give feedback to each teacher individually. And we also install an equality club in each school, and these clubs allow us to socialize what girls and boys from 5th and 6th grade have learned, all through child-led activities. And then we have 2 additional activities that were not originally in the project and that are a direct result of Save the Children's Mexico partnership with BNG Mexico, which are a fund for bathroom refurbishment and an in-kind donation of sanitary pads. What you can see on the right of your screen is choices content. It's a curricula of 11 choices divided into 3 theme blocks, and each of them corresponds to each training session. On the next slide, you can see, first of all, that there are 2 versions of choices according to which state it is implemented on. So you have the central version and the east version. And the purple stars indicate all sessions in which gender is directly addressed. So as you can see, choices links together gender and puberty, which is something we'll discuss further on. So on the next slide, we will be focusing on gender transformative programming and its relation to MHM. And my approach to this presentation starts with the question of what tools or strategies, aside from the gender equality marker, which I'm sure you're familiarized with, can be used to strengthen gender-sensitive or transformative interventions. And the answer to that question, which is what we'll be discussing today, is that focusing on and disaggregating key elements of MHM offers a different approach to gender equality. So on the next slide, I started off by taking these 5 priority areas, which were identified by Bethany Caruso and her colleagues, which could be understood as the elements that sum up menstrual health management. You have education, health, water, sanitation, and hygiene, also known as WASH, sexual health and reproduction, SHR, and of course, gender. I'll be talking about how our program activities align with each area, share some ideas and concrete examples of how MHM is integrated in We See Equal, and identify areas of opportunity or any weak spots. So starting with education, it is undoubtedly the overarching theme. Our objective is to transform gender norms, and we do so by building gender-sensitive learning environments. We work directly with teachers, as I've mentioned before, and they are trained on gender issues, and we increase their knowledge not only on gender, but also in puberty, and are therefore able to address these topics in their classrooms. A key element of choices is that the content is aligned with the Ministry of Education's curricula, so we offer an alternative to strengthen topics that are already seen in 5th and 6th grade. And then, of course, we by implementing choices, girls and boys receive choices content, and parents and caregivers, up until now, we haven't worked with them, but fingers crossed, in the next phase of We See Equal, we will design and implement workshops for them to be able to talk to the children about these topics. On the next slide, I talk about health and WASH jointly, because they both focus on how girls experience and manage their periods, particularly at school. And by openly talking about menstruation, we reduce the stigma around it to improve girls' management of their periods, which could be translated into different indicators that show better improvement of girls' menstrual health, hygiene management, improve of girls' participation in school. And although we do not measure the reduction of risk of urogenital and bacterial infections, and we have no plans on doing so, we do have elements to ensure that this is a direct consequence of receiving the choices content, specifically when it comes to health and WASH. And we achieve this by implementing puberty sessions, which involve activities on menstrual cycle, and they're given in mixed groups, both of boys and girls, but also male and female teachers. The equality clubs are key, since they usually hold awareness campaigns on the use of WASH facilities. And of course, PNG Mexico's WASH refurbishment project and the sanitary pads donation have allowed us to strengthen the integration of WASH into We See Equal. The next slide is just shows a before and after of one of the bathrooms we've refurbished, and we'll be working in 7 schools by the end of this year. This school is from Mérida in Yucatan. When it comes to sexual health and reproduction, it is very well documented that access to quality SHR education may increase boys and girls' ability to make informed and better decisions about sex. But unfortunately, the Ministry of Education's official curricula includes SHR in secondary school, and right now we're working in 5th and 6th grade, which poses a barrier to including SHR in choices. However, we do address pregnancy and its relation to child's life plan. So as you can see in this little graph, there's a direct link between increased knowledge about puberty and decision-making skills. And the last slide, of course, last but not least, gender, which is cross-cutting theme, but also we do address it individually. We start by identifying the differences between sex and gender, and move on not only to identifying harmful or limiting gender norms, but we also invite both teachers, girls and boys, to challenge these gender stereotypes. Now, I would like to get a little bit deeper into this and share with you how our training sessions with teachers are designed to go a little bit beyond just presenting materials for teachers to replicate them. So on the next slide, I would like to know that it is key for us to make sure that teachers own the content and question their own gender attitudes. So for example, we implement an activity with teachers in which we divide the group into 2 teams, blue and red, in which each team is treated differently just because of the color they are. The blue team represents how girls are generally treated, while the red team represents how boys are generally treated. And after the activity is done, we open up a discussion in which we ask, is this still a reality? And from my own experience, the answer is generally no. Teachers argue that the discrimination is no longer practiced. And then something you can see in the next slide is that we proceed to present a series of statistics on gender-based violence, women in STEM of politics, unpaid labor, preventable maternal mortality. And we ask the same question again, and the answer usually changes to a yes. And that's when teachers start to realize that there's a direct link between gender norms that are learned at a very young age. And these statistics, and they even recognize themselves as agents of change in their schools, but also within their families and with their friends. The next slide is just a quick summary, but I think we can skip this for now. And now I'll be sharing our monitoring and evaluation methods and results. So to begin with, the sample framework for each cohort of implementation, as I said, it's each semester, was established based on the total population of 5th and 6th grade students attending the 15 participant schools. So each cohort is a different set of schools and a different set of students. And it is representative of the population of students receiving the program, which is they're participating in choices sessions. We oversampled girls to ensure we surveyed girls that have had their first period, and all students have had to have parental consent to participate and agreed to be surveyed the day of the survey. And also all assessment instruments, methods, and consent forms were approved by Save the Children's Ethical Review Committee. And the results I'll be presenting will focus on the yellow boxes, which are the gender and puberty cap, the end line, baseline and end line. So on the next slide, this is a list of variables we measure, and the number next to each variable indicates the number of items or questions within each variable. The gender and respect questions are the ones we'll be focusing on today and are the ones highlighted in red. And they were modeled from 3 main different sources. The first evaluation of choices curriculum, which was implemented in Nepal in 2009. Then we have the Johns Hopkins Global Early Adolescent Study. And lastly, Promundo's Gender Equitable Men Survey. And we'll be sharing with you these citations at the end of this presentation. The next slide focuses only on the gender variables that I mentioned, and I've selected key questions to allow you to better interpret the results I'll present. When it comes to gender role rigidity, a high score would mean that boys and girls believe that women and men should share professional, domestic, and relationship responsibilities equally. When it comes to respect, a high score would mean that boys and girls believe that women and girls deserve automatic respect and agency regardless of their lifestyle choices. In this case, is a vignette about a girl named Maria, and we ask questions about how she's dressed and what should be, how should Maria be respected according to how she's dressed. And lastly, we have caring practices, which relates to caring about each other across genders and demonstrating caring with both words and actions, specifically to those who deviate from traditional gender norms. So on the next slide, we're going to dive right into the results. In general terms, this table is divided into the 2 cohorts I've mentioned, September to December and February to July. And each cohort includes a different set of schools and as children, as I've said before. When it comes to number 1, demographics, which is on the top, as I said, we oversample girls, and also having a computer at home was a proxy measurement of socioeconomic status. And now focusing on number 2, which is at the bottom, which is the gender and puberty variables. The red boxes show the % change in each cohort after the implementation. So as you can see, after our intervention, there were increases on all of the variables we measured, which is great. And all p-values show that these changes were statistically significant. So this slide in particular shows the results in aggregate, but in the next slides, we'll see results disaggregated into other sets of variables. So this first graph shows those same variables, but represented by states, and are only the results from the second cohort of the project. What's interesting to see from this graph is that the state of Merida is considered to be the most conservative state compared to Mexico City and Puebla, and yet it has the biggest changes, and these results confirm that in most cases, children who start with more gender conservative norms tend to experience the most change in their attitudes and behaviors after the implementation. The second graph on the next slide looks at scores according to baseline scores. The gray dots represent the aggregate scores that we've seen for each variable, while the red dots represent only the lowest scores, which are 40 or lower out of 100. So, for example, focusing on the gender variable, which is the second one you have here, the overall increase was 76 to 86, which is a 10 percentage point increase. But we're looking at children who got the lowest score. There was a higher jump, in this case, jumping from 32 to 49, which is the 17% point increase. So choices content seems to be especially strong for kids that start with low or poor gender attitudes. And we also disaggregated scores by sex to analyze differences between the results of boys and girls. But the differences between average scores were very small and usually not more than 2% in any direction. And the one interesting result is related to our respect variable. Girls tended to have lower scores at baseline and endline than boys in response to the vignette of Maria that I mentioned and how she's dressed. And these results suggest that girls may judge other girls' behaviors more harshly than boys do when they do not align with certain gender beliefs. And the final and last slide, I hope I'm okay with time. This is the last one. These are some of the challenges we faced after 2 years of implementation, and all proposed solutions could be implemented in We Say Equal Phase 2. So number one, there's limited time to review and really get into menstrual cycle and MHM, since the session that includes these 2 topics also includes ejaculation and wet dreams. So we are planning on designing separate sessions, one focusing on changes for girls and one focusing on changes for boys, but they will all be implemented in mixed groups. What is interesting to note is that both male and female teachers have demonstrated interest in this topic, which is MHM, which shows the need to go a little bit deeper and discuss maybe not only menstruation, but also fertility, for example. Number 2, there's a need for deeper integration of WASH into our programming, since we have relied on P&G's projects on sanitary pads, donation, and bathroom refurbishment. Our proposal for phase 2 includes a fund for which schools can apply to have their bathrooms refurbished. And the fact that they participate in an open call to get these funds would involve community mobilization and active participation from schools and their equality clubs. Number 3, as I've mentioned earlier, SHR poses the biggest challenge, and we are aiming to address these topics in our teachers training sessions and workshops with parents and caregivers instead of adding a choices session. And we would be focusing on strengthening their skills, addressing these topics with children, and also increasing their interest and ability to research this topic on their own, of course, using a perspective on children's rights. And lastly, as you can imagine from the previous slides, M&E monitoring and evaluation, may be really demanding, starting with the formative assessment to the development of tools and methodologies of implementation. In fact, all staff that participates in the service with children must receive a training on monitoring and evaluation to ensure the accuracy of the data. So we delineated several strategies, included, of course, budgeting for monitoring and evaluation to probably allow us to implement other evaluation tools like control groups and therefore generate more evidence. And lastly, participating in these webinars is key and really helpful to share ideas and experiences in general. And that's it from me. Thank you very much. This is just the bibliography I shared before.
Thank you, Sophia. And thank you, Yuna, again. Your presentations were great. I have a couple questions in the chat box I'm going to start with, but I would invite others, if you have questions about the Mexico presentation, to please put them in the chat box or unmute yourself and ask Sophia directly. First question is for Yuna. The question says, I would be interested in hearing more on the video on child-parent conversations on puberty. There are few tested parental engagement approaches for MHM, despite the recognition that messaging that children get on MHM at home is often different than what they receive at school. How is the video disseminated and received by parents?
Yep, thank you for the question. I'm pleasantly surprised you noticed that part, although I wasn't able to cover it during the presentation. So this is one thing that we also did for awareness raising, especially to parents and to community as a whole. We made a 1-minute video on the topic of making sure the puberty conversations happen between children and parents. And it's a very short clip that was televised in national TV. Their golden time, I think it was at 8 p.m. And it ran for a couple of weeks to continuously give this message that puberty education doesn't only happen at school, but it's really necessary for children to have their parents' emotional and social support, and that the parents also know about these puberty knowledges. So it was a video clip of having parents reaching out to children first to talk about the puberty issues together. Does that answer the question, Laura?
Yes, thank you very much. I guess just on, if there is time, follow up on that, I think is mentioned that in the Mexico project as well, there are intentions of having further parental engagement, and it could be, if there's time, it would be interesting to hear more about that as well.
Sophia, do you want to elaborate at all on any of the discussions that are happening about the next phase of the project and how you'd like to engage parents more?
Yes, so the proposed we worked on for phase 2 is focused specifically of attaining sustainability, because up until now we have trained teachers, but we have had to design a model of graduation in order to make sure that teachers are replicating. And also the teachers themselves and even parents themselves have asked us to include parents and caregivers through workshops. So next semester, hopefully, and fingers crossed, we'll be working on engaging them, and we'll make sure to look for all bibliography and other resources to implement them here. But up until now, we've only have one particular example of parents asking us to give a workshop, and what we did is sort of adapt what we've seen with teachers and present them to parents. But we're really excited to go a little bit further into which topics to address and how to address them. And specifically, the biggest challenge is making sure that we work with the majority of parents. And the good thing about working with parents is that we can also involve and include parents going from 1 to 6th grade, not only parents that have children in 5th or 6th grade. So it's something we are working on, and it's not delineated fully, but that's what we've worked into up until now.
Great. And there was another question about how, this one was pertaining to the diaries and specifically, but I think it could also be related to both projects. Any unintended outcomes, either positive or negative, from talking about MHM and how that might have impacted girls' self-perceptions and how they see themselves, since they kind of become the focus in some ways of the discussion in the classroom, or potentially an after-school project, an after-school effort. So I was wondering, have you guys anecdotally in those projects noticed how that resulted, or if there was any noticeable impact on girls from becoming the center of attention?
So as I mentioned, in Choices Mexico, there's one specific session that talks about menstruation, MHM, but at the same time, wet dreams and ejaculation. So teachers haven't, up until now, mentioned anything of negative impact of that. However, we do have the experiences of the donation of sanitary pads, and some schools and head teachers have told us that boys have felt as if they're not included because they're not receiving anything. But especially on the schools we're working in, because the donation is not only for schools that participate in Choices, but other schools. In the schools we're working in, we make sure that boys receive the donation, and we sort of justify that donation for them to be able to share those sanitary pads with their moms or with their sisters. So that's the only specific example of boys being as if they felt to be left out.
Very interesting. And Yuna, were there any kind of strange outcomes resulting from girls filling out those diaries that you remember?
Mm-hmm. So one of the things we were very cautious from the beginning was not to call it a menstruation diary. And so we framed it as girls' calendar diaries. So whoever is not part of it doesn't naturally link that to menstruation diaries. So I think that's why we had better participation from girls. They didn't feel so, singled out. So I think that worked out pretty well. Unintended consequences, I would say, is the reason why we planned the boys' puberty research. Same with Sophia, we felt like some boys felt left out. So we wanted to make sure we at least provide a platform and activities for boys to hear them out and see how they're feeling in this programming and in the puberty and menstruation education as a whole. So I guess that's the way how we try to circumvent that. And also, I think it's anecdotal. We didn't track it by numbers, but we did hear from teachers and girls saying that teasing and bullying related to menstruation decreased a lot after this programming. So it was a very happy extra result that we're seeing from this programming.
All right. Thank you so much, Yuna and Sophia, for your excellent presentations today. I just want to close this by noting that this recording for this webinar will be shared on Workspace and our School Health and Nutrition Workspace page, as well as the Save the Children's Resource Center for people who don't have access to the Workspace. Please keep an eye out for the invitation to our next webinar on December 4th. Same time, same place. We will talk about something that is rarely discussed but is really important for menstrual hygiene management, and that is quality standards of menstrual hygiene products. Please be on the lookout for that invitation coming soon. Have a wonderful day, and thank you, everyone.